Hello, my name is Mel Beige. I work for South Tyneside and Sunderland NHS Foundation Trust. I am a clinical team manager and specialist practitioner district nurse. Receiving the news that you have had an illness that cannot be cured, known as a palliative diagnosis, can be an extremely daunting and anxious time for you and your family, with lots of uncertainty and questions that you may need help with. Myself and my team of district nurses and community staff nurses will be with you throughout your care, along with other healthcare professionals such as your GP, hospital consultant or specialist nurse, who all work together to ensure your individual needs, choices and preferences are met as far as possible and enable you to be involved in your care planning. You will have a named district nurse who will coordinate your care needs, involving, with your consent, other members of our multidisciplinary team, such as your GP, a social worker or specialist palliative care nurse, if not already involved in your care. Our aim is to meet your physical, psychological, social, spiritual and cultural needs, including the needs of your family and carers. We can request support for you and your family from our local Marie Curie Centre, who can be with you and your family during the night, allowing some rest time for your loved ones. Usually you will already have a district nurse involved in your care from earlier in your journey, supporting you through your active treatment. However, if not, then your district nurse will visit you in your own home and introduce themselves and our service to you. Of course, there will be questions your district nurse needs to ask you as part of their holistic assessment of your current needs. However, this informs your personalised care plan to be implemented by your district nursing team. Your district nursing team will visit you as little or as often as your care needs require, so we do not encroach unnecessarily on your day-to-day living and precious family time. Our aim will be to enable you to be cared for in your own familiar environment. We are able to assess for and supply aids and equipment to help with any mobility issues and prevent skin damage to vulnerable pressure points. We are also there to help you deal with your thoughts and emotions regarding your diagnosis and palliative prognosis. We will assess your holistic needs at each visit, monitoring any symptoms or potential symptoms you may have as part of your diagnosis or ongoing treatment. Your district nurse will speak to your GP to arrange appropriate medication in order to control any symptoms quickly as they arise. This could be oral medication, but we can also help to administer your medication in other ways, such as an infusion. As time progresses, you will be visited at least twice each day by your district nurse, and our overnight team will also visit to monitor your condition and support you and your family. Your district nurse will encourage you to talk about your wishes and preferences for your care as you are coming to the end of your cancer journey. Planning in advance can help to alleviate any crisis or emergency and can help you to talk openly to your family members about dying. We will ask for your consent to share this information with any services you may have involved in your care, including your GP, so your wishes can be achieved where possible. In South Tyneside and Sunderland, you have access to community nursing services 24/7 via telephone. So whether you need some advice or have any symptom that is not well controlled, we are here to help you. I hope this has given you an insight into the role of your district nurse during your palliative end-of-life journey. Thank you for listening.